oriented grossly in our mid-sagittal view of the brainstem. Midbrain pons develop, anterior middle posterior hindbrain, the aqueduct, and the two colliculi, and the cerebellum, superior colliculus, inferior colliculus. If we look at this in the horizontal section to the midbrain segment with the aqueduct, the periaqueductal grade, we find a colliculus, a peduncle, a fossa, colliculus, substantia nigra, and we can draw a roughly horizontal line through the aqueduct, dividing the midbrain into three areas: the tectum, tegmentum, and the basis. Quite comparable to what we would see in horizontal sections through the pons. We have a basis pondus and a tegmentum. We don't have a tectum, but we have a cerebellum on top of that. Looked at from behind, we have a midline, the superior colliculus, the inferior colliculus, the pons in front, the aqueduct probably opening up here into the fourth ventricle, and the medulla coming down. So depending on how you look at this, you can see four bodies here: the quadrigeminal plate, right and left, superior and inferior. You can see it as a roof, or you can just see them as the two colliculi behind the aqueduct, right and left, depending on which side of the midline is actually cut through. Now, as with the cerebellum, we have to have peduncles, or tracts, connecting these suprasegmental structures with the segmental apparatus. And the nomenclature here is slightly confusing because we have the brachium, or arm, of the inferior colliculus and of the superior colliculus, which are sort of coming in from in front, from the region of the forebrain, coming in that plane, and serving essentially to connect the forebrain and the colliculi. And as we will see in a moment, the brachium of the inferior colliculus is largely efferent from the colliculus up into the forebrain. The brachium of the superior colliculus, on the other hand, is mostly afferent to the superior colliculus. Obviously, if you get into, or if you're coming out of one of them, you'd have to do the opposite. You've got to get into and out of both. So the terminology here is incomplete. And what we will see is that the way into the inferior calicus is through the lateral lemniscus, and the way out of the superior calicus is largely through the deepest layers of it, through the tectospinal, tectobulbar, other individual tracts. And these don't stand out so much grossly as these brachia, so that we have no easy, simple terminology at all comparable to the cerebellum. But the analogy is exactly there, that we have afferents and efferents to each of the caliculi. Any problems at this point? Well, let's start with the inferior caliculus and consider its afferents and efferents. And the major way into the inferior caliculus is through the dorsal and ventral cochlear nuclei, which are riding on the fronto-medullary junction like a side saddle. So they would be coming in here from in front, back. As dorsal and ventral cochlear nuclei. That, of course, is a strong hint of what the segmental afferent really is. And that, of course, is the bipolar neuron out here that comes in and gives collaterals to each of these two nuclei. And then over here, essentially horizontally, from the organ of Corti, the bipolar ganglion cells that end on the inner and outer row of hair cells, structures backwards. We have a row of inner hair cells and several rows of outer hair cells resting on a basilar membrane. And having a pectoral membrane floating over it, and the whole enclosed in a tube with fluid and this, of course, is the organ of Corti. A sketch of it. A cross-section of a long tube which is rolled up 2.5 times and receives from the middle ear through the stapes and the oval window with the outer ear and tympanic membrane. And so vibrations of sound that put the tympanic membrane into vibration, transmitted through the 3 ossicles, ending on the oval window, set the fluid in motion, and set this basilar membrane moving, depending on the frequency of the sound. The location from this long tube being made to oscillate at particular frequencies. And so we have the hair cell stimulated by this vibration. The bipolar neurons stimulated, transmitted to the dorsal and ventral cochlear nuclei. And what we'll find is that in this three-dimensional organ going off like so, and in a third dimension, that there will be particular places along that membrane that resonate with particular sound vibration frequencies. And so there's a very nice linear point-to-point relationship between the primary transducer for sound and the nerves responding. And we're going to see that repeated at every way station along here. You can see it in the dorsal and ventral cochlear nuclei. Needle electrodes going point by point along, recording the neurons that are maximally sensitive to particular frequencies. Any questions at this point? Okay, the dorsal and ventral cochlear nuclei. Yeah.
Sir, what's the difference in function between the inner hair cell and the outer hair cells? The same thing.
I'm not sure what the difference in responsiveness is. The outer hair cell row is particularly sensitive to excessive vibration. The innervation is different, something of the order of 1 or 2 neurons, 1 or 2 cells per neuron, versus maybe 50 per neuron out here. I don't know of any other differences. Probably just said the plasma membrane is where the blood vessels come in and supply the organ, and so that becomes a site for various toxins, drugs, in particular, that will damage these blood vessels, damage the hair cells with essentially ischemic necrosis. And so we have essentially 2 basic mechanisms for peripheral end organ damage. The sound amplitude damaging the hair cells themselves, and blood vessels supplying that being damaged by a variety of drugs. The cochlear nuclei then project across and up to the intracorticus as the lateral meniscus. Roughly 50-50, ipsilateral and bilateral, that is ipsilateral and contralateral, and coming from both dorsal and ventral. So over this scheme, we would have cells, computerized axons that extend into the intracorticus bilateral. Unfortunately, that's not the end of the story, because we have several other nuclei in this pathway. Better give it a name so I can. This crossing bundle of fibers is known as a trapezoid body, And it has a pair of nuclei that receive collaterals from the cochlear projection, and it gives rise to fibers that join the lateral meniscus on their way up to the inferior colliculus. And then we have the...
do they receive from both the dorsal and ventral?
Right.
What are the nuclei called?
Nuclei of the trapezoid body. That's one of the simple logical things that sometimes follows. Just in front of those we have the superior olive, which also receives from the previous systems. And which also projects up to the inferior colliculus through the lateral meniscus. Now this piece of the superior olive is a different piece than we've seen before. The same nucleus, but it's subdivided into several components, one of which is the motor output, the sensory regulator of the hindbrain segment. Whose fibers come back and end on the hair cells and provide inhibition of that first transduction. I'm going to leave them out because there are too many fibers already here.
Do they all project bilateral?
From here on up, from the superior olive on up, it's essentially ipsilateral.
What about the trapezoid? Do they go
Trapezoid is bilateral. And then we have nucleus of the lateral meniscus. In this case, an inferior nucleus of the lateral meniscus, which receives, probably guessed by now, collaterals from the more caudal tracts. And projects up to the inferior colliculus. And then we have a superior nucleus. Lateral meniscus, which is going to do the same thing. Having received collaterals from all the others that are coming past. And so we have a series of neurons, beginning with the bipolar ganglion cells out here, the aortic corti, to the dorsal and ventral cochlear nuclei, nuclei of the trapezoid body, superior olive, inferior and superior nuclei of the lateral meniscus, up to the inferior colliculus. The longest path that I've shown you is cochlear nucleus to inferior colliculus. The shortest is going to be from the lateral, superior nucleus of the lateral meniscus to the inferior colliculus. And they're going to be overlapping the cascading pathway, which And each station recapitulates the subdivision, orderly arrangement, topographic arrangement of sound frequencies. Any problems at this point?
So is there anything we can say about the function of these various nuclei, or do they just happen to be accidental interruptions on the way in between?
Well, I'm not sure that anyone has figured out why God made it this way, but it does allow the electroencephalographer with his auditory evoked responses to pick up in the response each one of these synapses, and so that one can identify exactly temporally in sequence each of the synaptic connections and whether they are arrived at the right time or whether they're present or not. They probably have a much more important function than that, than to keep the auditory evoked response collectors from starving to death.
Do they all map onto similar areas of the inferior colliculus, or do they all have their own separate maps once the fibers get there?
I'm not sure if that has been worked out, but at each point, it's the nucleus that has recapitulated the frequency scale. So they must be projecting pretty much in order.
So each nucleus recapitulates the entire frequency scale?
I think that's right. I'm only about halfway through the story. But in a way, it's a very well-designed system of keeping all these telephone lines running in proper sequence. But there's a lot of redundancy, as you just pointed out. There's tremendous overlap. Now it's going to get worse. Well, worse. The inferior colliculus is going to project out the brachium of the inferior colliculus to the medial geniculus, which is a piece of thalamus and it's going to project over to the temporal lobe, area 41, facials, gyrus, and there again, one can pick up a very orderly pattern related to frequency of input. As we look, though, at the contents of the brachium of the inferior colliculus, we find that it's not just the inferior colliculus fibers, but each one of these fibers that projects to the inferior colliculus also projects past into the medial geniculus. Each one except the cochlear nucleus, the second neuron, the first association plate element, seems to stop at the inferior colliculus. But each of the others bypasses, and the closer you get to the inferior colliculus, the more they bypass. So that we would have, for example, the nucleus of the lateral meniscus over here. In purple, I guess was the last one I used, which then fibers on past into the medial geniculus. And the next one below, in black, the inferior nucleus. Fibers come up and on into medial geniculus too. And so on from the superior olive. Red fibers come in. And the nucleus of the trapezoid body, I put in green, same thing, but has a lesser proportion of its fibers going past as compared to those ending. So we have a fairly regular pattern of long fibers and short fibers that overlap and are projecting to intraculiculus and medial geniculus. The end point is medial geniculus. That's why none bypass medial geniculus. But there's a consequence of this, and that is you can destroy the intraculiculus itself, preserving these bypassing fibers of the brachium, so that you don't produce much deafness from an intraculiculus lesion. The other correlate of this, from a clinical point of view, is that being a bilateral system, you cannot get the unilateral deafness distal to the dorsal ventral cochlear nuclei. Most unilateral deafness is going to be out in the primary sensory neuron, or the organ chordae, or the middle ear, or the external ear. So any questions about auditory system? There ought to be some questions, more along the functional, clinical components. Because this so far is essentially the conscious pathway for sound. There are some reflex responses to sound. The simplest of which is the eye blink. One can, by recording the twitch of the eyelid by mechanical phonograph needle type sitting on there and connected up to the amplifier, one can detect a response in that muscle within 5 dB of your conscious threshold. It's not very big, it's not visible grossly. It's just a little tiny blip. It gets bigger and bigger until you can actually see it grossly, but you increase the amplitude. And so this response is a pretty good measure of the sensitivity of the end organ, which can be easily used to detect malingering. Somebody says he's deaf, can't hear a thing. You can show that he at least has the peripheral auditory mechanism in place. And then the question is, how much centrally does he have in place? In other words, where are these connections being made? Well, you will recall, of course, that the eye blink is part of the facial musculature, and that the motor neurons of the 7th nerve are in the middle hindbrain segment. Axons curving back and around the 6th nerve is the internal genu, coming out laterally with the 8th nerve, going out past the silent, to the internal contrameatus and all that jazz, silent mastoid frame, and up here the eyelid muscle. And how do we get between these two systems? The earliest suggestion was that the fibers of the superior olive made their connections to the 7th nerve nucleus. the nerves really with the dorsal ventral conutex directly as they're making part of the trapezoid body that make connections to the seventh nerve nucleus. And then the suggestion was the superior olive do that. But as I've told you before, the superior olive fibers are the ones that are leaving the system in the other direction, crossing the midline, and going out to the hair cells as the crossed olivocochlear nerve. And it would look as though we don't really know how many synapses there are in this reflex, and that probably the lateral meniscus itself is giving rise to fibers into the reticular formation at various levels, and that it's the reticular formation that is giving rise to connections at the segmental level. So we have these coming in, the reticular formation, connections being made to the seventh nerve nucleus. And I guess the best evidence for that is that the eye blink turns out to be a small fraction of the startle response to sound. As if the sound comes in with a high enough amplitude and sharp enough click, the whole body will respond as part of the startle. And that just gets added on to the eye blink. You don't need the upper end of this. Just how much of the middle part you need hasn't been defined, as far as I know. But it does not seem to be just a simple 1, 2, or 3 synapses into the facial nucleus. Any questions on that? Because the next component is how much of this do you need to localize sound? To localize sound in the space, you need to have the two ears with a slight difference in time of arrival of the sound hitting the right and left ears. And you need to have the intraoculiculi and their connections rostrally, so that one can orient the head, eyes, towards the sound. So if my simple analogy of how to remember the name of the middle hindbrain segment, the components of the middle hindbrain segment, the sentinel segment, ignored a big chunk of the central nervous system of hearing and responding through focusing the ear and turning the eye, which gives you the 6th, 7th, and 8th cranial nerves. But there's a lot more reticular formation, colliculus, and some more that really orients the head and eyes towards the sound. So anything more about the intraoculicus auditory system?
Isn't there connections between the intraoculiculi?
There is a, yes, thank you. That thought went through and disappeared. There is a connection across the midline between the two. And what it does, I suppose, it really is to provide more of a bilateral comparison between the two sides that might become important in localizing sound with a slightly longer pathway coming in from one side as compared to the other. But there is a commissure of the inferior-clippus buried in the tissue above the aqueduct. Any other omissions, corrections, comments? Well, let's turn to the superior-clippus then. The superior-clippus is a much more complicated system in terms of what comes in and what goes out. In the bird, for example, it's the main part of the brain. There's very little cerebral cortex in bird brains. And so we're going to see essentially everything coming in to the superior-clippus. It is predominantly a visual system, which is why the brachium of the superior-clippus is coming in from the forebrain. So almost immediately, I hope to show you that that's not the whole solution of the story. The superior-clippus is a laminated structure. We're going to see this lamination recapitulated everywhere we look at the visual system. The retina has 3 layers of cells. The lateral geniculate has 6 layers. The visual cortex is very heavily laminated. You can see the line of Gennari grossly as a prime landmark defining visual cortex. And the superior-clippus is also laminated. So one of the rules of the visual system is to look for lamination. How many layers, Rita? How many layers are we going to see in the superior-clippus? 3. Are they going to be gray or white? That, you have to toss a coin. Look. Steve, you're frowning back there. Are the 3 layers going to be gray or white?
Gray.
Right, correct. So we got 3 layers of gray, and sandwiching them we're going to have 4 layers of white. And so we have a layer of white matter on the outside, a second layer of white matter, a third layer of white matter, and a 4th layer of white matter. And these are named the stratum, zonale, opticum, lemnisci, and profundum. And the names almost tell you what they contain. The outer 2 layers, zonale and opticum, contain fibers that are coming in from the visual system. So let me put a retina down here with the fibers of the ganglion cell, the 3rd cell layer, giving rise to optic nerve fibers, some of which are cross, chiasm, and enter into the stratum zonale, and synapse in the superficial layers, and some of which are going to go into stratum opticum. synapse in the outer two layers of gray matter. Others of which are going to come in from the visual cortex, occipital, and around, and mirrored into these outer two layers also. So in the sagittal view, if we have a retina out front here, and a ganglion cell, third layer of cell is going to give rise to fibers of the optic nerve, chiasm, and tract. Here, nerve, chiasm, tract, optic nerve, optic chiasm, optic tract. Their main goal is the lateral geniculum. For conscious vision. But coming through the brachium of the supracollicus, our fibers would bypass that and enter into the supracollicus, the stratum, the outer two white matter layers. And then, of course, we have conscious vision going back to the occipital cortex. The occipital cortex has more connections, and projections back down to supracollicus. So we have a forebrain system, which we'll come to when we get into the forebrain, that projects not only directly from the retina, but also from the visual cortex into what we might call visual layers of the supracollicus. And then we have fibers of the ascending somatosensory system. Spinothalamic, give rise to collaterals into the stratum menisci. And of the medial meniscus, same thing. And these, of course, have come. Medial meniscus has come from the nuclei of the posterior columns, vastus cuneatus. Whose cells give rise to crossing fibers and ascend as medial meniscus up to thalamus, but give rise to collaterals coming into supracollicus. And of course their afferents are coming from where, Jonathan?
Temporarily escaped me.
Ascending primary collaterals of posterior column fibers. These are nuclei of posterior columns. And of course, they came from the primary branching of what kind of cells out here? Small, medium, or large? We know it's not small. We know it's not small because those are pain temperature. We know it's not large because those are spindles. We got those into the cerebellum. And this is posterior column, so it has to be everything else. So these are medium-sized fibers that are carrying everything else. Hair movements, two-point discrimination, joint position. position, movements, light touch, little things like that. Not pain temperature and not muscle movement. Okay? And then, of course, we have the other system, and purple, and red, of the system that crossed and ascended, also to the thalamus, giving rise to collaterals, supracolliculus. And this system is what? Ray?
Sorry.
Steve? Eric? Spinothalamic. Right. Spinothalamic. Right. The lateral one. I'll give it a name. And I guess I forgot, well, I said medial meniscus for this other one. So we have the two somatosensory systems crossing at different levels, one in the spinal cord, one in the medulla, conveying all kinds of sensory input from the body, arm and leg, except spindles, up to the thalamus and on to the cerebral cortex, sensory cortex, for conscious appreciation of various sensations. Put it up there. Up to sensory cortex, 3, 1, and 2. This, of course, just to be complete, visual, 17. And the nucleus of the thalamus that does this, receives all this, is posterior central. So we have the conscious system, which we'll come back to later on when we get to the forebrain, but just to sketch it in there. Coming up in the midbrain, medial meniscus, lateral spinothalamic. Medial meniscus having begun down in the lower segments, immediately right next to the midline, as we come up, moving laterally, pushing the lateral meniscus more superficially, the lateral spinothalamic, down their way up to thalamus, giving rise to these collaterals into the supracolliculus. Oh, I forgot. What's the afferent to this nucleus? The nucleus that gives rise to the lateral spinothalamic tract receives its fiber from where?
It's marginalis, gelatinous.
So I thought I could catch somebody and say the small fiber system, you got a couple synapses before that. So we got, this is proprius, we've got splatinosa, and we've got marginalis. And then we get the secondary collaterals of the primary branchings of the small fiber system for pain temperature coming in through the Lissauer's tract. So small fiber system, primary branches in Lissauer's tract, secondary collaterals to marginalis, gelatinous, proprius, final output, spinothalamic tract. spinal segments on up. And of course, we also have parallel systems for the head, which just quickly, Eric, would be what? What would be the spinothalamic equivalent for the head?
Comes in the fifth cranial nerve, I think.
I'm sorry, I didn't hear.
Comes in the fifth cranial nerve.
Right.
To, the descending tract 5.
Have it come in, branch, descend, and if I've drawn this right, we have it overlapping with the Wasar's tract of spinal segments. So we have exactly comparable ipsilateral and crossing trigeminothalamic system for pain temperature. Exactly comparable to the spinal. And how about the medium-sized fibers for the head? Out of the ganglion, coming in directly to the main sensory nucleus, which we used last time to project into the cerebellum, as part of stage 2 of cerebellum. This time, though, they're going to project up to the thalamus. So we have thalamus receiving head, quintothalamic, trigeminothalamic, arm and leg, spinothalamic, medial meniscus, all up here in the thalamus, on through the cortex.
The nucleus for the medium size fibers for head zones. This is about.
They are going to go exactly parallel to the spinal cord bones, so we end up with a lamination of the medial meniscus system as face, arm, and leg, as these fibers have come in almost straight in the segment, the main sensory nucleus, in that same segment, giving us the crossing fibers probably in that same level almost, and joining the medial meniscal fibers that have come up from below on the medial side. So we have this rough lamination of the face, arm, and leg for medium-sized fiber systems. The spinothalamic tract having also from below had crossing fibers from the nucleus proprius of the nucleus of the spinal tract of trigeminal that cross, come in to join the spinothalamic tract fibers medially, so that as they go out and push up, we have the face, arm, leg lamination here. And as those two are going to go up into thalamus, they become recombined, face, arm, and leg, and instead of separated by modality, small fiber versus medium fiber systems. So any problems on the afferents to the supraeclicus? We've gotten essentially everything except smell and spindles into the clippers. Smell is going to have its more or less private forebrain component. The spindles more or less private cerebellar component. Now, rather belatedly, I have to label Rita's 3 layers of gray matter for the supraeclicus, and these are very imaginatively named. Any suggestions?
1, 2, and 3.
1, 2, and 3. How about that? 1, 2. And oddly enough, it's layer 3 whose cells are going to give rise to the output. Through the stratum profundum, it's going to cross. And the major name for this is tectospinal, which implies it's going to go down the spinal cord, out, around the aqueduct, crosses, and descends the tectospinal tract, just beneath the floor of the fourth ventricle. So if you look at a cross section here, you're going to see tectospinal tract and medial meniscus in front of it. I've got that one, of course. That's the medial MLF, which is the most superficial. So we're going to have MLF. Then the tectospinal, and then the medial meniscus. Coming down the midline. And the next one, in the cross section of the medulla, from the floor of fourth ventricle, coming ventrally.
Some midline ones.
How many should we have? Obviously the answer is 3, but here we have an exception. We've got 3.
Pyramid.
I got the pyramid. So we have 4 of them to look for in a cross section. And since I've done that, I don't have to do that. Here we have the sulfatins. They're all in a pyramid. Here we have the hypoglossal nucleus, and here we have a bunch of white matter coming down like so. Where's the MLF, tectospinal, medial meniscus, and the pyramid. Like that. The midline of the posterior hindbrain region. These are not segmental structures. They just have to be passing by. But here's the hypoglossal. Now here's going to be the ventral vagus, rostopharyngeal, whatever, ambiguous nucleus. And up here is going to be the dorsal vagus, autonomic. And here's sulcus limitans. So association plate, going to be a lateral flap. This is our motor plate. So here we have tacked on, covering over the segmental apparatus, inferior olive, which is stage 3 of the cerebellum, pyramid that we will talk more about before brain, MLF we talked about with the middle hindbrain, vestibular system, extraocular muscle. It's intersegmental. Tectospinal we just put in. Medial meniscus. Sketched in. We'll talk about it more later. So those are some of the suprasegmental structures that we put into this section, obscuring the segmental apparatus behind. And of course, among the association plate elements out here, for this particular segment, we had the solitary tract, its nucleus. We had the spinal tract of the trigeminal, its nucleus, laminated. We have the ascending fibers of the inferior cervical dorsal spinal cervical tract, being joined by fibers of the inferior olive that come across. Coming down from a higher segment, we have the vestibular nucleus. Ascending out in here, we have the lateral spinothalamic tract. So one can go through any particular section, reconstructing the segmental structures, and then adding in the various intersegmental or suprasegmental, descending, ascending, descending, cerebellum. So you can go through in a reasonably orderly fashion, building up the cross-section from your known segmental, intersegmental, suprasegmental, ascending and descending pathways. Well, that's sort of a little digression, just to amuse you for the weekend. Any problems? I'm 5 minutes overdue over the time. I'll just let you stew for the weekend about the functions of the superior plate. Take that up first thing Monday morning, 6:30. You're right in traffic.